We are going to talk about some important ECGs. Uh, Please like and subscribe my channel, Dr. AK MRCP. Let's now look at this ECG. First of all, in ECG, you need to know the rate of the ECG. So rate is calculated by simply dividing number of big boxes, these are the big boxes, by 300. So if you calculate uh, rate, now you need to know that the number of the boxes between one are this and one are this is divided by 300. So now calculate the number of big boxes. In this case, 1, 2, 3, 4, 5, 6, 7, 8, 9. So it is 9. So 300 divided by 9, it comes about 35 to 40 beats per minute. So the heart rate is simply calculated like this. So this appears to be bradycardia. So whenever there is bradycardia, you need to be aware of heart blocks. So there are two heart blocks in which RR interval are constant, type 1 and type 3. In type 2, RR interval will never be constant. So either it is type 1 or it is type 3. Now in type 1, the P wave always, the QRS complex is always followed by P wave. But in this case, you can see, but there is PR prolongation in first degree heart block. But in this case, you can see this PR is coming, then P wave is coming here, then a P wave is coming here. So there is no coordination between P wave and QRS complexes. So this occurs typically in third degree heart block. So one finding in this ECG is disassociation between P and QRS complex and slow heart rate. So this is a third degree heart block number 1. Now in order to calculate, next thing you see in the ECG is after rate, rhythm is axis. In this case, for accurate, for just rough calculation of axis, you need to look at lead 1 and lead 3. So if it is upwardly directed, you put your left thumb on lead 1 and right thumb on lead 3. Now you can see there is negative deflection in this case in lead 3. So this is left axis deviation. This is left axis deviation. Now other thing that you need to see is the V1 in this case is usually V1 is downwardly directed and then gradually an upward R wave appear if you know the normal ECG well. In this case, V1 is upright. So this is right bundle branch block. You can see in this ECG. Bundle branch block will occur when there is broadening of QRS complex or there is or V1 if V1 is upright. So this can be a cause of right bundle. This can be because of right bundle branch block. So now the finding in this ECG is a right bundle branch block, a complete heart block, and a left axis deviation. So this is a typical ECG of a trifascicular block, which is commonly placed in exams. So you need to know this ECG very well. There is another term, there is another ECG that you need to focus on. I need to show you something else. So now see in uh, this is shown trifascicular block, which is a combination of right bundle branch block, left axis deviation, third degree heart block, and a true trifascicular. So this is a true trifascicular heart block, in which case you have already seen in the previous ECG there will be three things. One will be left axis, third degree heart block, and a right bundle branch block. So if you see this combination in any ECG anywhere, you can easily say that this is a trifascicular block. Now this is one more example of a block we are going to discuss. In this case, you can see the PR interval is prolonged. So there is PR interval prolongation. Again, the axis is deviated as left axis deviation, and V1 is upright. So this is RBB. So now you can see this is nowadays called as bifascicular plus first degree heart block. Previously, this ECG was interpreted as a trifascicular block, but this was not a true trifascicular heart block, because in this case only there is prolongation of PR interval. So thank you for watching this video. I hope you have learned some tips, and you have learned some important clues about recognizing the trifascicular block. Thank you.